Hello, welcome everyone, and I want to thank you for joining us for this live discussion on diabetes and eye health. We just want to let you know that we're having a little bit of connection issues, so we may need to post this a little later. But my name is Lee Ann Lazarus, and I am the eye screening manager at the Trinidad Eye Hospital. And today we will be talking about something many people don't realize, and that is how diabetes can quietly damage your vision long before symptoms may appear. So, this discussion is very timely as this is November, which is Diabetes Awareness Month. And we are very lucky to be joined by two incredible guests who work with diabetic patients every single day. So, firstly, we have Dr. Dhanoo, who is the president of the Diabetes Association of Trinidad and Tobago, who has a wealth of knowledge surrounding diabetes and diabetes care. We also have Dr. Ronnie Bhola, who is the chief surgeon at the Trinidad Eye Hospital and a retina specialist, also well versed and well renowned within his field. I want to thank you both for being here. So let's get started. Andrew, I'm going to turn to you first. So, Dr. Dhanoo, when people hear about diabetes, they mostly think about blood sugar levels being high or medication. But diabetes also affects so much more than that. Can you explain what really happens inside the body when blood sugar stays high over time?
So thanks for that question, Leanne, and of course, thanks to the Trinidad Eye Hospital for doing this activity in the Diabetes Month, November. So often that's a question we get quite a lot because people want to know how exactly diabetes and high blood sugar that's caused by diabetes causes problems in the body. And I'd start by saying diabetes causes problems throughout the entire body, and it affects the entire body simply because it's a disease that affects your blood vessels. Of course, you have blood vessels everywhere, from the little blood vessels in the eye to the big blood vessels in your heart. So the problem is when you have diabetes, you tend to have higher blood sugars. Now, higher blood sugars floating around in your blood means that it tends to also react with the proteins in your blood.
Mhm.
And those proteins reacting with your blood sugar result in something called glycation or glycated proteins. Now, these glycated proteins are things that are kind of foreign to the body, and they also tend to stick up on the walls of the blood vessels, the walls of the arteries, the walls of the veins. And as we know, when something is foreign to the body will attack it, right? It's a foreign invader. And that's essentially what happens, and we call it inflammation. And that's essentially what happens. Your body's own immune system attacks your blood vessels when the blood sugar is too high. And when your blood vessels are damaged, wherever the blood vessels are found, then obviously those organs are going to be damaged as well. So here's why diabetes causes these problems over a long term. So again, high blood sugar is not going to cause this over the course of a day, but over the
Mhm.
course of years, and oftentimes people have high blood sugar for years, and that's really where the problem builds up. So again, you have damage of the blood vessels, damage of the little blood vessels in the eye could lead to retinopathy and glaucoma and a cataract, all the things we're going to talk about in this. But of course, the damage to the blood vessels in the kidneys you can lose your kidneys. You need dialysis, you eventually need a kidney transplant. Dialysis, losing blood vessels or damage to the blood vessels in the bottom of the foot eventually make you lose sensation in the bottom of the foot, prevent it from healing properly. And then, of course, we end up with slow healing wounds and you get cuts and you get um, eventually losing a limb, right? So again, this is really the main reason why you have the issue of high blood sugar resulting in damage throughout the entire body.
Right. So, since the theme of November is awareness, do you think that in terms of your time at the association, do you think that the level of awareness in Trinidad and Tobago's population has raised over the years towards diabetes?
Yeah, I definitely think so. I think during the course of my tenure as the president of the association, we've been able to do quite a lot more at the association. We've been able to reach quite a lot more people, and now we're able to do more than we've
Mhm.
been doing before. So people know about diabetes, they know about the complications, and most importantly, they know about the steps that they could take to prevent it and the
Mhm.
steps that they could take to control it. So I think definitely, yes, we have been doing quite a lot of work. there's quite a lot of work to be done still because more people are being diagnosed every day. And
Mm-hmm.
we know that it is, in a sense, an uphill battle because we are using education, we are using testing, we are using medication to fight biology, to fight the environment, and that's essentially what's happening here. So it's very difficult, but it's a job that we are doing, and of course, with the help of organizations like TH, we're able to do a lot more.
Yeah, could definitely attest to the hard work of the Diabetes Association. So, Dr. Bhola, we start, um, let's talk a little bit about diabetic retinopathy and how diabetes affects the eyes. Can you go into that a little bit for us?
Yeah, thank you. Thank you for having me on the program, Leon, and congratulations to the eye screening unit, and congratulations to the Diabetic Association for doing yeoman service, tireless work in trying to educate people and in trying to change people's lifestyle to a better lifestyle so we don't see all these changes. And as Andrew was saying, um, the biochemistry he was giving us there, and you know, I remember learning it, but when he's just talking about it there, he really um, shows us what's going on, and
Yeah.
I appreciate that simplification of the whole thing because he could have given us the PhD biochemistry and he made it simple so we could
Yeah.
follow it. So,
Mm-hmm.
but it really writes home to what we see, explaining that that damage to the capillaries, the small blood vessels, which is what we have in the eyes, and especially in the retina, in the macula in particular, it's really just capillaries there. And those capillaries, we could see the damage
Mm-hmm.
clinically when we look in, when you take the photographs, when we do the scans, the OCT scans. And now we have OCT angiography. So we could actually see the blood vessels and see which ones have been damaged and how many have been damaged by the by the process of the blood sugar, whatever it's causing, and then all the other risk factors contributing to it.
Mm-hmm.
And what happens in the disease is that it affects these little capillaries and makes them leaky. So they leak fluid. So we see fluid within the retina, and that means the retina gets thickened. We also see some yellow cholesterol-like or lipid-like deposits within the retina, and those we call exudates. So we see the yellow stuff. And if the blood vessels are really damaged, we then see blood itself coming out into the retina. So those are the kind of things we see.
Right. So, Dr. Bola, I asked Andrew about awareness. What do you think in terms of what you see in the clinic? Do you think that people are being proactive towards actively seeing about their eyesight? Are you seeing patients in the earlier stages or in the later stages of diabetic eye disease?
Well, I think it's not a good situation.
Mm-hmm.
Um, Whether people know or not is a good question. I don't think we've been able to assess and study how much people actually know
Mm-hmm.
about the problem. Um, what is the cause of the increase and rise? Well, it has to be related to eating the foods that unfortunately is one readily accessible,
Mm-hmm.
tastes pretty good,
Mm-hmm.
and also affordable for
Mm-hmm.
a lot of the population. And I think all those factors really makes it. And probably the fourth thing, if you were trying not to not to eat the foods that could cause it or could worsen the condition, you would have to really try
Mm-hmm.
to get it. So accessibility to healthy food is another thing. Accessibility and affordability. And I think it's so many factors that probably contribute to people having to make the wrong choice,
Yeah.
and maybe it's not that they don't know, because these days with social media, internet, everything, I think a lot of people know that what's good for them and what's not good for them, and they unfortunately, for whatever reason, if they're forced or not, they have to make tough choices.
Yeah. So that's why prevention is very important. That's why we screen, we do community screenings, and that's why we partner with the Diabetes Association to kind of raise that awareness and try to help people understand the importance of early intervention, particularly with eye health and your overall health when you're diabetic. Um, so Dr. Bhola, what does screening actually look like? What does that involve when we go into the community?
Well, I think this would have been a good question for you, Leon.
Yes,
I,
yes.
I yeah, I would do my best. And even Andrew might be also,
We'll help you.
all three of us, I think, could answer this one.
Uh-huh.
The the screening in the community is, we do it with a photographic screening method. There are a few methods, but that's the one that we employ, and it's because it's probably the best method
Mhm.
to be able to screen. It has shown a really high chance of picking up disease, not missing anything, and also picking up disease pretty early, being able to identify persons at risk. And I think that would really help people, because if
Yeah.
they know something's happening in their eyes, and people really value eyesight.
Hmm.
So, and for good reason. I mean, everything we do is through these two things,
Yes.
in life. So if one starts up, I could sense worry for anybody. So once we start to look at people's eyes and they realize that this thing could lead to blindness, then and we could show them it. I think it would encourage them a lot in taking care, even if if it means spending more time in the kitchen, spending more time trying to prepare your meals, making sure at the end of the day you go for a little walk at least,
Yeah.
or something like that. But these little changes would make a huge difference. One of the big things that happens when the eye screening unit goes out into the community, is that they educate. They
Yeah.
don't only take pictures, they spend a lot of time educating. And that is a key factor in the
Yeah.
fight against this scourge of diabetic eye problems.
Right. So, Dr. Dhanoo, I know Dr. Bola spoke a little bit of the effects of diabetes on the eyes, and you would have spoken about this a little bit before, but could you explain the systematic effects and how that connects to the eyes and different areas throughout the body as well?
Yeah. So I think we may have touched on this a little bit because as we would have mentioned that it's really the blood vessels that of course are damaged and throughout the body you have damage there. Now, what we also need to understand is that because there's damage throughout the body and the blood vessels are damaged and you have damage to different organs, you also have different symptoms.
Right.
Oftentimes, these symptoms are related to each other. And what's important is that sometimes these symptoms pop up earlier than others. So,
Mm-hmm.
for example, problems with the eyes, one of the earlier symptoms of diabetes, and it
Mm-hmm.
actually could be a warning sign other bad things are happening to your body.
Very
So
true.
so you have damage to the blood vessels of the eyes, blood vessels of the kidney is also being damaged as well as at the same time. And
Mm-hmm.
and there's evidence to show this that people who have bleeding at the back of the eye also may have kidney damage, also at risk for amputations, also at risk for heart disease.
Yeah.
And this is why this type of screening that we're doing with the eye hospital throughout the country is so important, because when you detect persons with retinopathy, when you detect persons with these problems, you then are able now to direct them not just to eye care, but you're directing them to doctors who could be able to follow up on other things that are going on in the body. And
Yeah.
when they make these changes, whether it be medication or personal changes in lifestyle, to get the eyes better, essentially getting the entire body better as well. So we have to understand, just because diabetes affects the entire eyes, the entire body, you also need to understand, of course, by making these interventions, you actually treat the body as a whole. You
Yeah.
look at everything that's happening, and this is why it's so important to get the screening, not just the blood test, but of course the eye,
Yeah.
get the eye test as well. And I want to mention one thing because Dr. Bhola was talking about um, the work that you all do at the eye hospital, and for the month in particular, for Diabetes Awareness Month, the theme is diabetes in the workplace, and that's
Mm-hmm.
the international theme that we're using. And I think it's important with eye health because we know that most people depend so much on their eyes to do everything day to day. And
Yeah.
when they lose their eyes, then they oftentimes are no longer able to work. And we have many, many persons who may be losing their eyesight and still working. One, they could put persons at risk if it is that they're doing a job that is very risky as a driver, as a
Mm-hmm.
doing machinery or something like that, and they're putting themselves and other people at risk. And two, of course, when in fact they get to a state when they no longer functional, then of course they can't work and then they
Yeah.
lose if they're the breadwinner or they support any family, they lose that ability to get that income. So, and I think more and more because diabetes are affecting younger and younger persons of working age, and actually 4 out of 5 people with diabetes right now are of working age, which means that these people are at higher risk of developing these eye diseases. And
Right.
of course, this is why we need to take special care. This is why we need to do screening. Maybe do screening on workplaces, to be able to capture persons who are wouldn't typically think of themselves, getting diabetes or getting any of these eye problems. So it's very important again to touch on that.
Yes, definitely. So you would have mentioned you know, be doing actionable things. What would you say are the initial steps someone should take to improve their lifestyle, Dr. Dhanoo?
Yeah. So initially, the first step is to test
Mm-hmm.
the blood sugar to see what's going on, and particularly we would advocate to do an HbA1c test. And this is of
Right.
course a test that's going to give you your average blood sugar for the last 3 months. It's going to tell the physician whether or not you are well controlled if you are living with diabetes, and if you're not living with diabetes, it'll tell the physician if your blood sugar is in a range which we could describe as pre-diabetic.
Right.
It tells if you do have diabetes, and that's important because then certain interventions can be made. If it is
Mm-hmm.
that you are in the diabetic range, and of course medications would be given along with lifestyle interventions, lifestyle changes, and that's actually the most important part.
Yeah.
And if you're in the pre-diabetic range, then lifestyle interventions are most important. So again, here it's all about controlling your weight. It's all about increasing exercise and improving what you consume. It's all about doing things that also make you unhealthy. So stopping smoking, stop drinking, extra sleep.
Mm-hmm.
Or enough sleep rather. So all of these are ways or interventions that you can make to improve your chances of not developing diabetes. So again,
Right.
it's important to know that, and it's important to know that, to be honest, 90% of the effort or 90% of the work
Mm-hmm.
to control your blood sugar is what you have to do for yourself, not just the medication. And most persons just think it's the medication, the tablet that they take, the
Yeah.
medication they take is going to do all of the work for them. But that's not true. It's really what they do and the changes that they make are really what's going to be able to control the blood sugars and control the diabetes.
Right. Thank you, Dr. Dhanoo. So we're gonna turn a little bit to some questions that the audience has for us. Um, so I would give this one to Dr. Bhola. So, the question is, will everyone with diabetes get diabetic eye disease? If not, what percentage of people might get eye disease?
Yeah. Before I answer that, I really like what Andrew is saying
Mm-hmm.
about a lot of points. Just to home in on one of them is that the disease in the early stages is asymptomatic.
Yeah.
There's no symptom.
Mm-hmm.
And that's why screening, just to make the point that screening is vital for this disease. The other great news is that screening is painless and simple.
Mm-hmm.
It is a photograph of the eyes. The other big point is that that photo, as Andrew was saying, gives a lot of information
Yeah.
about about what happened, not only what happened in the eye, but what happened with your diabetes in
True.
every part of your body.
Yeah.
So, it's a biomarker of everything. And
Mm-hmm.
it tells you about your kidneys, and it tells you about your neuropathy, everything. So I think if you were to take anything away from this whole thing, just make sure somebody takes a photograph of your eye.
Yeah.
Once you think you're diabetic, or you just found out,
Yeah.
or if you were diabetic and you didn't do that yet, that's a straightforward thing. The third thing is these guys work and make this thing free for you.
Mm-hmm.
So, oh gosh, don't delay it.
Yeah.
Um, because it could pick something up that could save your kidneys, could save your eyesight, and probably could save your life.
Yeah.
So please go and get this photograph of your
Yeah.
eyes.
And it
Um,
should be done once every single year. Every single year, because people delay and that's when problems happen. So every single year it's free. There are no excuses. Check your
yeah.
eyes.
And they'll be able to pick up early signs,
Hmm.
and that's a big deal.
Yeah.
So I just want to make that point. You could just repeat the
Of
question.
course.
The person had.
So they asked, what does everyone with diabetes get eye disease? And if not, what percentage of people you would say develop eye disease at some point?
Well, our stats is probably the best I would say to go by with this one. Um, Diabetes really doesn't affect everybody
Hmm.
because it's a multifactorial. Sorry, diabetes doesn't cause retinopathy in everybody because there are a lot of factors that affect whether you get affected or not.
Hmm.
Um, and one of them is your genes. So we know people who take really bad care of themselves and they're diabetic, and they get no retinopathy.
Hmm.
And the only explanation for that is that they genetically predisposed for protection of their retina.
Hmm.
Um, However, the majority of people we see and don't fall into that category. So that's really the less than 5%. The 95% of people uh, have multi-factors to cause eye problems. Their diabetes it's up and down and out of control most of the times.
Right.
Um, so that's one. Their blood pressure is also a problem in the majority of them. It's difficult to manage for whatever reason. They're usually struggling with other things, the weight and everything. So that's the group that really we see with advanced diabetic problems. Um, the group that we see with mild problems, because we have a lot of those that don't get problems.
Yeah.
Um, and I would say from our research, about 10% would require some form of treatment.
Hmm.
Um, about maybe 20 to 25 would require us to see them a little bit regularly in the clinic. But out of that 25%, 10 would probably need something, either laser injections or surgery. Um, when we looked at it, 1 to 2% really end up having surgery, but the majority would have clinic procedures to control the problem.
Right.
So those are kind of the figures for the diabetes. and
Okay.
the retinopathy.
All right. So, Dr. Dhanoo, someone asked, um, interesting question. They asked if your blood sugar is high constantly, but they're not diabetic. Can they develop diabetic eye disease?
Right. So two competing ideas there. If your blood sugar is constantly, then you need to go see a doctor,
Yeah.
or you mean it's either you know your blood sugar is high and you need to go see a doctor, or you think your blood sugar is high and when in fact it not really is high. But if you think your blood sugar is high or you know your blood sugar is high, then you need to go see a doctor. So let's just tell them what is high. So if it is that you had something to eat, meaning that you did not fast, your blood sugar should not rise over 180 milligrams per deciliter. And then it's going to come back down. If it is you did not eat for the last 8 to 10 hours, so say when you get up in the morning and your blood sugar is over 125, then you should go see a doctor as well. Even if your blood sugar is over, well, between 100 to 125, that means you may be in the pre-diabetic range. But over 125 in the morning, definitely go see a doctor. Over 180, 2 hours after you eat a meal, definitely go see a doctor as well. But yes, so definitely it could put you at risk, but definitely go see about that blood sugar.
Okay. Thank you, Dr. Danu. So we have another question. How important is diabetic eye disease for children living with type 1 diabetes? Dr. Danu, you wanna start and Dr. Bhola can add some points?
So definitely we've seen young children developing cataract. We've seen young children developing retinopathy because some of these children have been diagnosed maybe as young as a few months old. And the thing with type 1 diabetes is especially, it can be considered especially aggressive simply because there's no insulin being produced. And
Right.
sometimes when the blood sugar isn't regulated well in these children, their blood sugars tend to be very, very high, and therefore they tend to have a lot more damage a lot quicker. So you might see teenagers coming to us and you know, they're losing their eyesight. And young people in their 20s living with diabetes for 15, 20 years and they're losing their kidneys. So again, it's very important, especially for the parents of these children, to have the annual screening. Again, it's a picture. It's a picture at the back of the eye. It's a photograph. It's non-invasive.
Yeah.
You're not going to feel anything. You're not going to feel any pain. But of course, it tells you all of the information that you need. So it's very important for them. And we have a lot of our type 1 children come to get eye screening whenever we
Yeah.
do eye screening. A lot of them come and they come annually and their parents bring them. And, you know, so it's very, very important.
Yeah. Dr. Bhola, you wanna add to that?
I just gonna add I know you all were doing some work looking at obesity too
Mm,
in children, and then how that might be affecting the incidence of or prevalence of diabetes in children. And I think again it's the Western diet that really is the
Mhm.
challenge, you know, for the young the young generation, a little more than the old because the advertising is crazy for these things, and and that's making it really more difficult for them because they have to make better choices
yeah.
because we're seeing an increase
Hmm.
in the obesity in children and in diabetes in children,
Yeah.
and that's a serious thing because they have a long way to go, you know, so they're going to have a high chance of developing advanced disease needing kidneys, needing eyes,
Yeah.
you know. So I think that's a serious concern we have.
Yeah. We definitely get a lot more children than when we started, when we screen. Definitely when we go to the Diabetes Association headquarters as well, because they encourage them. So hopefully we're making positive impacts there. Dr. Bola, so a question for you. Is it possible for a patient with a cataract to also have retinal detachment?
Um, so we see both cataract and retinal detachment in one eye. I mean that's not an uncommon situation. Um, whether the retinal detachment causes the cataract. We also see that as well. Sometimes people get the retinal detachment and then because they have it for a while and it hasn't been repaired, they get a cataract. So we see them sometimes separately,
Yeah.
cataracts on their own, retinal detachments on their own, but we also see them in combination. So the answer is yes. And the way we deal with that is we do both surgeries in one go. We remove the cataract, put a lens in, and then we go to the back of the eye and repair the retinal detachment. It is easy to say, but the retinal detachment repair is challenging for the patient because they need usually more than one surgery to try
Yeah.
and repair it. And even if we repair the retina, the vision is always never back to what it was. It always compromised. So although we could repair it and the doctors feel pretty happy they repaired the thing, it really does mean that the repair only gives partial sight or not full sight.
Okay. All right, Dr. Bhola, another question for you. Um, is floaters a symptom of diabetes eye disease? If not, what causes it? And is there a difference between black and white floaters?
Um, well, floaters there are many types of
Hmm.
floaters and many causes of floaters. The most common cause of a floater is an age-related condition called a vitreous detachment, posterior vitreous detachment. And it happens in most people over the age of 60. So they say, to make it easy to remember, they say 60% of people over 60 would develop a posterior vitreous detachment, which means they would notice floaters in their lifetime. And those, they, the patient may not notice a color. They might think of it as dark or um, mainly because it casts a shadow on their retina
Right.
um, because of the optics of the eye. But so most of those age-related floaters are dark. Most
Mhm.
people come and tell us they think they're dark. But when you look at them, they're actually white.
Okay.
It's the type of floaters that really worry in diabetics is blood. So blood could also do the same thing, cast a shadow on the
Hmm.
retina because it's in the vitreous.
Right.
So that's what we call vitreous hemorrhage or bleeding in the eye. Um, and that blocks your vision, but it could also give you the symptom of a floater, something
Mm.
in front of your vision, and you think it might be cobwebs, and you're trying to see, well, what's going on here in front of me, but it's in the eye, and it feels like if it's just in front of your eyes or your vision.
Right. Thank you, Dr. Bula. So, Dr. Dhanoo, we have a question for you. What causes weight loss in someone who is diabetic and not on a strict diet? They watch what they eat, but at the same time, it's not consistent.
Yeah. So one of the classic signs of diabetes is weight loss and sudden weight loss on diagnosis. So basically, when the diabetes really gets to the point where we could define it as diabetes, you tend to have a lot of weight loss, and this happens because now when people consume food,
Hmm.
most of the energy they get from food is from sugar. So usually 75% of your plate is sugar essentially because the starch that you eat is sugar. The rice, the roti, the bread, it all turns into sugar. Now, with diabetes, one of the classic signs of diabetes is urinating a lot. So polyuria, we call it. So you're urinating a lot. And when you're urinating a lot, the body actually urinates a lot because the blood sugar is high, because it's a way to get rid of some of the sugar from the body. Because what's happening is you're eating food and the sugar is getting into your blood cells, your muscle cells to give you energy. So it stays in the blood. And one of the mechanisms the body has is to get rid of the sugar through the urine. So you pee more, but why peeing more, you pee out more sugar. And once you pee off more sugar, that's energy you're peeing off, that's calories you're peeing off. And
Mm.
if that energy isn't going in your body, in your cells to give you energy, then your body needs to turn to fat. It's stored fat. So as your body turns to stored fat for energy, then you lose weight rapidly. So that's
Yeah.
one of the reasons why you lose weight so quickly. So again, a classic sign of diabetes, sudden weight loss because of this phenomenon.
Right. Thank you, Dr. Dhanoo, for breaking that down for us. Definitely learned something there. Um, so I know we could talk about diabetes and diabetes care between these two gentlemen for a very long time, but unfortunately, we are running out of time. So I just wanted to hear from each of you, a little bit of a closing statement. So what would you like everyone to remember from today's live? Dr. Dhanoo, I'll start with you.
Thanks. So definitely the important point is to get screened, especially for the month of November.
Mhm.
We have quite a lot of activities. The eye hospital is in a lot of the public libraries across the country. And of course, we're also in a lot of the public spaces across the country as well. I believe we have almost 10 screening opportunities where persons can go get their eyes screened for free. So take advantage of that. And also, if you need assistance, reach out to the Diabetes Association. Our head office is in Chaguanas on Success Street. We also have branches throughout the country in Trinidad and Tobago. If you want to reach us, you can give us a call at 607-3288 or visit our website, diabetes-tt.org. Go to Facebook, Instagram, TikTok, any of those social media outlets, and you could be able to get information and you could be able to reach us at the association.
Thank you so much, Dr. Bhola.
Yeah, and just add to that too, if you could reach out directly to the Trinidad Eye Hospital um, and all the platforms to try and book an appointment as well to get screened because we also screen at the clinics.
Mhm.
Um, I, I I I just like that point that was made by Andrew and then Lee Ann, that picking up this disease early is really the key. And the patients are asymptomatic or people are asymptomatic, so they think they're fine, and that's the persons that need screening. When you already have the problem, well, you don't need screening anymore because you're in the treatment phase of the problem of the disease. So you really need to get your eyes checked because early diagnosis means better outcomes, means you could save your sight and save your life.
Yeah, definitely. Thank you, Dr. Bhola. So I want to thank everyone for joining us. If I could just add a little point, I again encourage you to have your eyes screened. You could reach us at 235-4834 at the Trinidad Eye Hospital, or you can go onto our online platforms on social media to sign up for any of our locations. You can reach out to the Diabetes Association. You have so many opportunities to be proactive in your eye health, in your care. And that's what we really promote between the Trinidad Eye Hospital and the Diabetes Association. I really want to thank you for taking the time to listen to us. I wish you a good evening and we'll see you again soon.